Good evening, everyone, and welcome to another webinar hosted by the Greenwich Hospital Medical Library. My name is Veronica Blanken, and I'm the Consumer Health Librarian at Greenwich Hospital. For those of you who are not familiar with me or what I do, I help residents in Greenwich and its surrounding communities find and understand health information, as well as become aware of the health services available in their area, and in doing so, help them make better healthcare decisions. So tonight's topic is on fall prevention, and it is going to be another part of my Where to Find series, where we will be going over primarily online resources that are easy to navigate and accessible to anyone with an internet connection and access to Google. So when it comes to falling, it is by no means only an issue for the elderly. Anyone of any age is capable of falling and incurring the accidents and injuries that come with it. However, the demographic most at risk for falling is the elderly, and the CDC considers that anyone 65 or older. So if you are someone who is in that demographic, or a caregiver who cares for that demographic, or are a family member of someone who is within that risk factor demographic, this is definitely the presentation for you. So before I get started, I always begin my presentations with this disclaimer. My degree is in librarianship, health librarianship. So this presentation is for educational and informational purposes only. So please always consult your doctor or other healthcare provider for medical advice before making any lifestyle decisions that may impact your health. And that also no sponsored content will be featured in this presentation. None of the resources that I will be sharing today are paying me to do so. They are all peer-reviewed, researched, funded privately funded organizations, or funded by the government. So the topics that we'll be covering today are primarily for fall prevention, but I categorize them in terms of general information resources for improving balance and strength, home modification resources, and state and local support resources. All fall under the umbrella of fall prevention. So the CDC has an extensive amount of information on falling statistics and tips for fall prevention, but I just thought it would provide some context for why this is such an important issue, especially as we get older, because the fall death rates in the US have been increasing for the last 2 decades. So you can see it starts from 2007 and only goes up to 2016, but it is predicted that if the rates continue to rise, we can anticipate 7 falls deaths per every hour by 2030. So every year, 3 million older people are treated in the emergency department, primarily for fall injuries. More than 95% of hip fractures, a very common operation associated with it being hip replacement, are caused by falling. And that falls of any age are the most common cause of traumatic brain injuries, which, as we know, is a permanent and lifelong condition. So the American Occupational Therapy Association has identified several categories for risk factors associated with falling besides age. Those are the physical risks, behavioral risks, and environmental risks. So they all seem pretty self-explanatory, but I'll just go over some examples associated with each one. For physical risks, that includes having poor eyesight, being vitamin D deficient, having hearing problems, diabetes and heart disease, and also any side effects that may be involved in the medication that you're taking. A very common side effect of most medication is dizziness, for instance, which is definitely can lead to falling, to a much higher falling risk. Behavioral risks include what we do. So that may be also what we don't do enough of, which is physical inactivity, too much sitting, or not using assistive equipment when we need to use it, such as a cane or a wheelchair, or the mechanical chair that goes up and down the stairs. And then last but not least, we have environmental risks, which are any hazards in the home, such as rugs that are not tampered down, or very sharp corners on in the kitchen table, for instance. Or this can be hazards in the community, such as no ramps or a lot of puddles or cracks on the ground. And there may be some communities that unfortunately don't have a lot of handicap accessibility, so going up the stairs is the only option, which can lead to a lot of risk when it comes to falling as a result. And one of the risk factors that I think a lot of people overlook is that once a person does end up falling, they actually develop a fear of falling. So once somebody actually has an experience of falling and may not result in an injury at first, but it will result in them fearing falling again, or having to admit to themselves that, oh, I may have an issue with falling, or a balance issue or whatnot. So the AOTA has seen that leads to inactivity, which can lead to weakened legs, which of course we see is behavioral risk, physical inactivity. And it can also lead to people feeling lonely and thus depressed because they're not going out as much because they're afraid they're going to fall. Therefore, they're not seeing their friends, they're not doing their favorite activities. So that is something that people need to consider, is that even if it's scary to fall, that there are definitely ways to prevent it, which is what the next slide will be about. So the National Council on Aging has created a guide that tells you the 6 steps to prevent a fall. I have a little picture over here. It says, every 11 seconds, an older adult is seen in an emergency department for a fall-related injury. Many falls are preventable. Stay safe with these tips. So I'm just going to go over these steps one by one, since it's pretty hard to see it over here. So the first step is find a good balance and exercise program, which we all know will help to decrease physical inactivity and help strengthen the muscles that you need to keep within balance. To definitely talk to your healthcare provider, who can assist you with what the type of program that you might need and what medications you should stay away from. Which leads to the third step, which is to review your medications with a doctor or pharmacist to see if there are any side effects that are taking over your balance and coordination, and whether you should switch to something else or have a lower dose. Get your vision and hearing checked annually and update any eyeglass prescriptions you have. To make the necessary modifications in the home, whether it be to install assistive equipment or tape down the rugs in the area, get rid of any hazardous corners that you may fall into. And then last but not least is to talk and involve any family members that the person may be who is at risk of falling, may be living with, so that they're aware and can provide support when needed. Not to mention provide a means of transportation so that they're not as afraid to go out into the community and still enjoy activities. So if you are not sure where to start looking for this information, and this is where I go, especially if I have someone who comes to me for health information and I'm not aware of the condition at first, I recommend the very easy to use a MEDLINE Plus. It is a database created by the National Library of Medicine, which is the largest medical library in the world. And so actually I'm going to show you from the beginning. So if you put into Google MEDLINE Plus, this is the home page. So if we wanted to go to fall prevention, we go to health topics. And of course you can always put in just fall prevention in the search over here. But in health topics, there's 2 ways you can get to fall prevention. You can go to older adults, scroll down to the F section, and look up fall. And we also have safety issues over here under health and wellness. And down in the F section, this is all in alphabetical order, you see over here falls. And then it takes you to the page that they have on falls. So for those of you who have not seen MEDLINE Plus before, it's what I call a gateway website, where they have, not only do they have a lot of great links to a lot of great organizations that have been peer reviewed, they also organize things very well, narrow it down to the thing that you really want to know. So if you only wanted to see diagnostics and tests regarding fall prevention, you just click there and it takes you straight to that section. If you're an older adult looking for information, you just go all the way down to the older adult section. So it's just very, very useful for someone who doesn't know where to start research. And it informs you of the organizations that have the most reliable, up-to-date information. This is where I got a lot of the resources that I'm going to show you today. And then they even have little PDF handouts that you can print out for yourself. I did a whole presentation webinar on Medline Plus. It's a tutorial on it, and I can show you where to find it on my website after this presentation as well. So we're going to go over the first step, which is to find balance and exercise programs. So the National Council on Aging has a website that has a lot of evidence-based programs. I'm just going to click here. Okay, hold on a second. I gotta bring it up. Just one moment. And it should work now. Yep, okay. So this is the National Council on Aging website. And here they have a whole list of evidence-based fall prevention programs. So the way it works is you go on the left and you can read about each one. So for instance, A Matter of Balance is an 8-week structured group intervention program. And evidence-based fall prevention program, evidence-based just means that it's been tested in a study, it's been shown to be effective for people for that purpose. So that just gives it more credibility in terms of what might work for someone who's trying to find a balanced program. So you can see there's a lot, and a lot of them are not, can be based in maybe a specific state, or they may be available, it might be an organization that's available in your own state. They have like search databases where you can put in your zip code and see whether it's available in your area. Or they can be like this one, I believe, which you can just look up their courses right there and be able to join in. So yeah, over here, this is from the Oregon Research Institute, and they have an events calendar. Looks pretty blank, but for now, they do have instructor training workshops, for instance, and other programs that they do, and apparently you have to contact them if you're interested. So that's just one place for potential balance programs. On this website, I also found something that might be useful for those of us who aren't sure if we are at risk for falling. So they say right here, the coronavirus pandemic has changed a lot of things. Falling is not a normal part of aging. These are steps you can take to reduce your risk. So you answer these 12 questions that they ask, and based on these results, you can bring these to your next doctor's appointment and see if you guys can come up with a plan to prevent falling in the future. So that's just a free assessment that you can take. So next we have the National Institute of Aging, which is closely coordinated and in contact with the National Council of Aging. They have a lot of great information when it comes to exercise for older adults. There used to be a separate site called Go for Life, which had all of the older adult exercise, but now it's just merged onto this website. So as you can see, they have the 4 types of exercise, how to get started, finding the right fitness clothes, just all sorts of topics relating to being physically active as an older adult. If you want to go specifically to their fall prevention site, you go to Health Topics. Scroll down, you can go to the F section right here, Falls and Fall Prevention. So they have a section just for about talking to your doctor, balance problems, fall proofing your home, which we'll be talking about later on, about home modification, and preventing falls and fractures. A lot of great tips on how to avoid it. We just spoke about the risk factors for falls. This is where I got most of that information. And for those of us who are living with family, this is definitely something you could share with them. You can share what to do exactly if somebody in your family finds you on the ground after falling. And as you can see, there are more resources here, which I will be sharing, but you can definitely look on your own. And one last thing I wanted to draw your attention to were these free publications that are available to order. So they have it on a lot of topics involving aging, such as Alzheimer's disease. And I actually, if you were able to visit the library, I actually have a lot of these publications on hold here. They're very easy to order online, but if you'd like me to mail them to you, I'd be happy to. So, and I especially really like this one. This is a very, very extensive everyday guide on physical activity and exercise. You cannot, unfortunately, order print copies of it anymore, but you can get a PDF version of it. I'll just show you quickly what it looks like. So the way that they have it organized is that they set it up as describing the four types of workouts that they encourage. It would be for endurance, for balance, strength, and flexibility. Yep, these are the 4 different types of exercises. And then if you go to the very end of it, they actually show you pictures to describe you what type of how to actually do it and how many times to actually do it, and then what it'll actually be for. So for instance, this exercise is for your back muscles. If you've had hip or back surgery, talk with your doctor before trying this stretch. Definitely, that's always why I put that disclaimer at the beginning of my presentation, is always ask your doctor before just trying anything like this. So you can see a lot of exercise to look through, and all available for free through this website. What's also available for free is the exercise playlist for those of us who prefer to work out to a video. They have those exercises available on YouTube. They have a YouTube playlist. So 12 videos in total. So they have workouts ranging from 15 minutes to 10 minutes to 20 minutes, and they can show you which type of exercise group you want to focus on, either endurance, flexibility, balance, etc. So that's very helpful. And then we also have, oh, my bad, I didn't mean to click that. We also have this is the link for the exercise and physical activity guide, the big book PDF that I just showed you. So when you look at your handout or you want to go straight to that guide, you can just click that link right there. And then last but not least, we actually have a local resource that I wanted to draw your attention to, which is the Greenwich Town Hall, well, just the town website. But they have a special department website called the Commission on Aging. And they have a lot of Zoom programs available. I can't show you the Zoom program on here because it's a Google Doc and we're not allowed to access Google Docs from my work computer, but they do have a lot of scheduled programming from the Connect, using the Connect organization. And if I can just bring that up here, I can tell you what's going on. Yeah, so they allow you to join a live session the 10 minutes before the class. And for instance, today is December 15th. So we missed all the classes that day. But for instance, for tomorrow, there's trivia with Lynn, Italian class with Luciana, Keep Your Brain Healthy with Heather Gately. And when it comes to fall prevention, we've got Wendy with Zumba on December 17th at 10:30 and Tai Chi with Bill at 1:30 p.m. So if you just go to this website and just click on this Zoom session schedule, you'll be able to see whatever's upcoming. And it's, from what I can tell, it's all available for free. And while we're here, I can just draw your attention to all these great COVID FAQ sheets, which also have resources on them, such as how to provide transportation, free delivery meal services, and all the good stuff. support group information, wellness workshops, a lot of great things available through here, the Commission on Aging. So one of the steps that we already reviewed was to review your medications with your doctor. So when you actually go to the doctor for your visit, you can't be expected to remember everything that's going to be told to you, especially when it comes to all those long names of those medications. So the National Council on Aging has provided a handy medical record, PDF that you can print out from your own home. You can print out multiple sheets if you have more medications to write down. And it talks about your pharmacy, your phone number. Not only is this important for you to write down, but it's also good for your doctor to know too. You can even make a copy of this and give it to your doctor. But as you can see, you can write down the name of the medication, purpose or reason for taking it, the dose, time of day, and special instructions. Now this is really important, as we talked about. Some of the side effects of medication can actually be a risk factor for falling, such as being dizzy, or and special instructions, so that would go in there. So that's good for you to know. And one of the things I wish that they had on here, maybe you can put on the back of this, for instance, is what medications you've been taken off of as a result of that kind of side effect. So you can maybe put those medications that you previously were on, were taken off, on the back. And when it comes to if you rather not have to find the papers or print out papers, you can also use this website called drugs.com, where you can not only create a list once you sign up, you can also look up specific drug information, its side effects, get discounts even, and like I said, you can record your medication list. So I'll just quickly show you what that looks like. So drugs.com has a lot of great features. Once you sign in, you need to sign in order to create that medical list where you can write down your medications and create a full medical profile. But they also have drugs and medications, just general information. They have a pill identifier in case you have a lot of pills in one bottle, for instance, and you don't remember what each pill is. I use this all the time. Interactions checker to see if it's safe to take 2 medications at once, as well as the side effects for each one. So it's just a great database for each of the medications that you may be given. And it's also a mobile app for all those who are mobile tech savvy. So next we get to home modifications. So there is an organization called Rebuilding Together. They're mostly known for assisting communities with who've been through disasters such as hurricanes and tornadoes and such, but they're also known for providing home modifications for low-income families. There is a Rebuilding Together organization for Fairfield County, but their website is looks a little out of date. It feels like it hasn't been around for a while, but you could definitely contact them. But they do provide a really handy home safety checklist that I can show you. So you can see, you can print this out and you can identify particular fall hazards and accessibility issues. And it goes over extensively, such as the entrances and exits, the laundry, telephone and doors, storage space, windows. It just really, really gets detailed so that you don't miss a thing. That's what I really like about it. So this is from that Rebuilding Together site. And then we also have a great resource from the School of Gerontology. They have a whole consumers page on home modification. So you can see they not only are concerned with environment and home modification, they also give you resources on balance and mobility. Falls can be prevented. You can prevent falls sheets, guide to home safety for seniors, simple steps to prevent falls. So you can see lots of great resources. And they even mention the CDC study program, which I also have a brochure on. This is their check for home safety list, home fall prevention checklist for older adults. And then if we go back, we also have data on falls in California sorted by county. This is a California-based university that this program's in. But it also has medical management, brochures, talking to your doctor about falls. That'll definitely be something to consider when you actually visit your doctor. So this is very, very easy to look through. A lot of great resources in here. And then, like I just mentioned, the CDC has their own prevention checklist. Quickly show you that here. And I wish I could say that it's easy to order a publication of these for print, but most of these are usually available only online because they're trying to save money by not printing so much. But as you can see, it's nearly almost identical to the other checklist and just as extensive. Literally print these, really easy to print out one of these pages or more and just be able to check all the rooms in the house. And then we also have an agency for aging for Southwestern Connecticut. This is basically a list of what some people may be eligible for when it comes to a home care program. So if you are 65 or older, a CT resident, and complete a free in-depth assessment, you could be eligible for physical therapy, minor home modifications, or just modifications to the home in general if it becomes a little bit too expensive for someone, for instance, to install a assisted stairway machine or something like that. They also have a program, The Money Follows the Person, where it can help lower income families who are trying to live at home create those same modifications for themselves. So this is who you would contact to see if you're eligible for this program. And then we're going to just go over quickly the local patient and caregiver resources. This is one we've seen before, the Greenwich, Connecticut website. Just wanted to go over the resource guide that they have for older adults. I had a lot of questions last time during my Alzheimer's webinar regarding what services are available for that. Well, the same thing can be said for fall prevention. This is just a really helpful PDF to show you what exactly is available in Greenwich from the Commission on Aging for what resources are available. So they go from stuff like adult daycare to aging for life care professionals, just all the websites and all the numbers that you can contact. From Alzheimer's to caregiving respite to counseling, household help and errands, chores, mental health services, elder abuse. So it's just so many resources that are available in Greenwich. And I keep hearing that a lot of people don't know about it, and I'm hoping that this resource guide will be able to help with that. So then we also have the Connecticut Department of Health website, and part of that Connecticut Department of Health is their Department on Aging and Disability Services, and where it's basically kind of like the Agency on Aging website I just showed you, where you can apply for specific services. They can range from the Technology Loan Program, the Respite Care Program, Level Up, the National Caregiver Support Program. All of these have some element of elderly care involved, and fall prevention or being at risk for falling can definitely make you eligible for any of these programs. And then last but not least, we have the Greenwich Hospital's own Center for Healthy Aging. And this is the page for the center. If you go on the Greenwich Hospital website, so they have a lot of great features, such as an aging assessment, which could help figure out if you're at risk for falling. They have geriatric services and support programs. And they also have geriatric psychiatry services and social services liaison and geriatricians who can tell you if you're at risk of falling and what steps to take if you are. So I would definitely give them a call, because that is definitely a local resource that's easy to get to in Greenwich. So that was my presentation. Thank you so much for attending. And like I said, I'm going to show you right now where you will be able to see a recording of all my webinars, as well as this one, once this gets posted. So this is my website, the Dr. Stephen Mickley Community Health Resource section. It's a really long name, but if you just click on the link in your PDF, it'll take it to you right away. So you go to this tab and go to webinar recordings. And then this is the page where I post all my webinars. So like I said, this webinar will be in this box right here under where to find series. So I have one on Alzheimer's disease already and COVID-19, and one on phone apps. A tutorial Medline Plus is right here. We're gonna have more food and nutrition next year, but right now you can look at the healthy holiday eating guide, because holidays are upcoming. Christmas and New Year's is just around the corner. And I highly recommend What Do I Ask? Your Role in Healthcare, because I go over tips for how to make your visit to the doctor more productive, especially given the short amount of time you may have to even have a visit. So this is where you'd go. And over here, we also like to think of this website as a gateway website, the same way that Medline Plus is. So if we go to the healthy aging, you will see a lot of the same sites that I talked about and even more. So you see we have quick links to a lot of great resources. And we also have something on fall prevention, such as the Fall Prevention Center of Excellence. And I could have gone over it. I did go over it. So that they just had it under a different name on that website. But as you can see, just a lot more information's in here, and I don't have enough time to go over them. So you can definitely visit this section and be able to look for yourself. So I think we have one question. I'm just gonna pull it up here. Is the full Healthy Lifestyle Bulletin available online? Healthy Lifestyles Bulletin. Could you specify what you mean by that, Gary? I'm not sure. Is that something I mentioned in the PowerPoint? Yeah. So I don't know if you heard me, but I'm not sure what it is you're speaking about. Is there any other questions from anyone else? If there isn't, I just wanted to let you also know that you can register for more free and upcoming webinars on the Greenwich Hospital site. The bulletin from the hospital. Are you talking about the Center for Healthy Aging, Gary? Sorry, I'm like a little confused on what you mean. Yeah, unless I mentioned it here, I'm not sure what you mean, unfortunately. Why don't you email me about it, and I'll try and figure out what it is you're looking for. And just to go over again, this is where you would register for free or more upcoming webinars, or you can call this number. I myself am going to be taking a break for about 2 months, so my new webinars for next year will be starting in March and April of 2021. A lot of great things upcoming, and I'm going to have guest speakers for once. Some people from other departments in the hospital who have a lot more clinical expertise than I do. So I'm really excited. And when I emailed people about tonight's program, I actually heard a lot of people saying that they had issues getting links, or they're having issues registering for the program. If there is a program that you'd like to register with me, you can definitely email me as well. If you're having issues, you can email directly at this email or call me on my office number, and I can directly send you a link if you're interested in one of my webinars. So sorry that there's like issues, but it happens, and I'll try my best to get you in regardless. You're talking about Health Extensions. Okay, yeah. So Health Extensions is a magazine that a lot of you guys have been using to be aware. That's where I've been promoting my webinars. I'm not sure, actually. That is a great question, Gary, though. I know On Call is online. That's for employees. I know that there's another online newsletter that gets sent out to people that has programs listed on it, but I'm not sure if that's Health Extensions. I will definitely get in touch with marketing tomorrow, and I'll see about that, because it would be great if there was an online section. Thanks, Carrie. Yeah, I'm glad that you're a repeat customer here. That you're so interested in what I've seen you multiple times. So I'm glad that you keep coming back and hearing what I have to say. I work really hard on these, so I really appreciate when I get good feedback like that. So are there any other questions for me from any other of the participants? I'm sure there's like a ton of more resources, but those are like I always try to do, I try to narrow down exactly what would be the most helpful for people, especially in this area. Like I said, a lot of people have been telling me that they're not aware, or because of the pandemic, that a lot of the resources they used to go to are not available anymore to go in person. And we all know that it's a lot different going in person than it is to be seeing someone from a screen. It can be very disassociating and it can make us feel lonely, but important thing to do is to just keep being consistent and following the directions that our doctor has given to us. That's the important thing. And to just remember that things are looking up. We have a vaccine coming out. They've been distributed at my hospital, and perhaps in the next year we might be seeing things go somewhat back to normal eventually. But we have a whole world available to us of support services online, and I'm hoping that the online resources that I shared today, if you didn't know about them before, you are more inspired to take a look at them now. So that's my overall purpose, is to help people out in this really difficult time. So if there isn't any more questions, I think this is where I'm going to end for tonight. And once again, thank you so much for attending. This was my last webinar of this year. It's been great. And I really look forward to seeing you and some new people in my webinars next March. So keep a lookout for Health Extensions March and April and sign up for my programs then. Thank you and have a good evening.